This is Dr. Jack Allergy. You can follow me on my YouTube channel at Dr. Jack Allergy. That's DrJackAllergy. And on Twitter at hashtag Dr. Jack Allergy, spelled the same way. This is part 2 of treatment of hay fever and allergy symptoms. So part 1 was focusing on medications that go in the nose. Part 2 is going to focus on medications that are systemic as well as immunotherapy. Okay, so my most favorite, saltwater wash, nasal corticosteroids, nasal antihistamines, combination therapy, nasal aerosols, and now we get towards the oral antihistamines, which are not my number one go-to, and most of the times, by the time I've seen you, you've already tried one of these or multiple. They come in a couple different flavors, as I call it. The first generation, which are going to be your Benadryl or diphenhydramine that are over the counter. Some people have gotten prescriptions for medications known as Atarax or hydroxyzine. Those are your first generation. They work okay, but they're really only good at bedtime because they do cause drowsiness. And the other problem is they're short acting. They only last for 6 hours at the most, typically 4 hours. Better choices in this that are still not my top choice would be second generation oral antihistamines. This includes your Zyrtec, Allegra, and your Claritins. Not a big fan of Claritin. Claritin, if you look up its history, the true effective dose is 20 milligrams. They sell it at 10 milligrams, and so that's bogus. They do that for a drowsy issue, and they reap a ton of money from this. That's why you'll see there are 15 different generic brands of Claritin. My recommendation is typically to start with the Zyrtec. If that causes any drowsiness, then I recommend Allegra. The generic stuff works just as well. Okay, so Zyrtec, Allegra, Claritin, there are a couple of prescriptions. I think there's one known as Clarinex. I could be wrong, and this might be over the counter. But the one that I definitely know is called Xyzal, Xyzal. And this is an isomer of the Zyrtec. And it works well, but it's prescription strength. So it just depends on cost is really what it comes down to. Moving to the next class of medications that are effective is going to be something known as your Leukotriene receptor antagonists, LTRAs, or better name is Singulair, which is a once a day. The generic is called Montelukast. These are very effective in the pediatric or children population. I really like them for both allergy and asthma type symptoms. The other one in this class is called Accolate, Accolate. It works just as well as Singulair. The only reason why you might not have heard of it is because it's twice a day compared to Singulair, which is once a day. Once a day will always be chosen over twice a day. But Accolate is equally as effective. Both work very well. Studies have shown that combination therapy of an oral antihistamine, such as Zyrtec, with an oral Leukotriene medication, such as Singulair, works better in combination than either one of them alone. So if you need certain therapy quickly, and I can put you on the Zyrtec Singulair combination or anything in between similar to that, oral antihistamine or a Leukotriene modifying medication, that is better than either one alone, although still not my recommended choice if I have my choice what to give you. Okay, there are nasal decongestants, and this is something that can lead to a medical condition called rhinitis medicamentosa, which basically means severe rebound congestion due to overuse of a nasal vasoconstrictor. So Afrin, Dristan, neosynephrine, any of these are okay in the short term. The big side effect is that if you use them long term, they lead to that medical condition, rhinitis medicamentosa, where you will have significant rebound congestion once the medication wears off. And this can be a long-lasting problem where you start to get actually addicted to using it in order to open up those passages. And the other drawback is that you need the medication more frequently because it becomes less effective over time. This is when you do need to go and see your allergist to get a good therapy so that you can get off of the nasal decongestant medication, the Afrin, the Dristan, the neosynephrine, and be put on something that's going to work appropriately. There is nowadays some discussion about combination therapy, which I do use for my really congested patients, that will combine a nasal steroid and the nasal decongestant, but that's going to be a little bit something that we should talk about in the office instead of on YouTube. Okay, there are oral decongestants, which I am really not a big fan of. These are your Sudafeds, your pseudoephedrine, and there's another class called the phenylephrine or PE that you might see on the container. I am not a fan of PE medications at all because, most importantly, they have side effects and they're really not that effective. If you're going to take an oral decongestant, go with Sudafed or pseudoephedrine. This you're going to have to get from the pharmacist and sign your life away with all that junk because of a couple of idiots who decided to make meth or try to make meth with it. Nevertheless, these can be effective in the very short term, but the reason I'm not a big fan of them is they have a lot of side effects. They cause high blood pressure, increased heart rate, feelings of agitation, sleeplessness, and insomnia. Overall, they just are not a good long-term therapy because what they're doing to your blood vessels inside of you is they are squeezing them down. They don't just squeeze down the stuff to open up your nose, the blood vessels there, they are causing squeezing of every blood vessel in your body. Lots of side effects. They can be used in very short-term therapy, or if you see the doc and this is something that we've come together to agree on, that this might be a benefit. Okay, so saltwater washes, number 1. Nasal corticosteroids, number 2. Number 3, nasal antihistamines. Number 4 is going to be combination therapy of nasal steroid and nasal antihistamine. You can do 2 separate sprays or the 1 spray that Dymista. There is nasal aerosols. That's going to be next on my list. Then we're going to oral antihistamines on my list of moving down the list of what I prefer. Then the Leukotriene receptor antagonists, Singulair or Accolate, are the trade names, Montelukast or Zafirlukast. Then we're talking about the nasal decongestants, Afrin or Dristan, which is more, I would recommend that before I'd recommend Sudafed or pseudoephedrines, which are the oral decongestants. That's my list of what I recommend, all the way down to what I recommend the least. Okay, last thing is immunotherapy, also known as allergy shots or sublingual immunotherapy. We call it SCIT, S-C-I-T, subcutaneous immunotherapy. It is incredibly effective. It works. If you are allergic to trees, grasses, weeds, cats, dogs, dust mites, mold, what is there? Well, maybe that's it. I don't know. Cats, dogs, yeah, all that jazz. We can put you on allergy shots. They are very effective. The side effects of allergy shots are, number 1, feeling better. They are not expensive in the pocketbook. Especially, studies have shown that over the life of your allergy shots, you will save approximately $8,000 to $16,000 because of less doctor's visits, less antibiotics, less allergy medications, less missed work in school. Overall, the benefit is huge. The drawbacks with allergy shots are it's expensive in time. You have to go to the allergist or your primary doctor and get your shot. When you start with allergy shots, you're going to need a shot a week. We have to build you up, and I can't give you the maximum dose because I don't want to kill you and you don't want to die. We want to get you feeling better. So there is a building process. Once a week for approximately 12 to 16 weeks, and then every 2 to 4 weeks thereafter. Usually it's once a month thereafter. The length of allergy shots are 3 to 5 years. If you really want to get better and you're committed to getting better, 3 to 5 years. There is other therapy. There is sublingual or the allergy tablets. I'm not a big fan right now. Number 1 is they're expensive, really expensive. Number 2 is you need to take them almost 9 to 12 months in the year regardless. Number 3, they still have large requirements for the use of a lot of your allergy medications. Number 4, the long-term benefits have not been well established at this point. Number 5, they are very limited in what they're treating. It's 1, 2, or 3 grasses, or maybe just ragweed. It does not have all this cross-reactivity that you can get with your allergy shots. Sublingual immunotherapy has its place and can be very beneficial in the future once we become smarter with it. But at this point, it is not something that I would go towards or recommend unless my patients really, really beg it or want it, because you're going to be paying a lot of money out of pocket that's going to cost you more than allergy shots or just medications. Okay, this is Dr. Jack Allergy. Please feel free to follow me on my YouTube channel and on Twitter. If you like what I am saying, please feel free to click the like button and please subscribe. Thank you, everybody. I hope that this helps. And if there are questions, please leave them in the comment section and I will try to get to them. Thank you.